Hello everyone, my name is Charity. Welcome to my YouTube channel. So on this channel, I am going to be sharing some nursing content. I am a registered nurse. I want to use this platform as an avenue to educate the public about my profession, but to also answer some questions that I often receive about nursing. So if this is something that you are interested in, I would encourage you to subscribe and to look out for more. So in this video, I am going to be sharing a general definition of nursing, and then I'll go a little bit deeper into what nursing is specifically, and then also share some titles that you will find in the nursing profession. So then the first question that we really want to ask is, what is nursing? What is nursing? So the definition that I was able to come up with is that nursing is a profession within the health sector, and it's also a career path. So I actually looked at the word profession in Google Dictionary, and it says that a profession is a paid occupation, especially one that involves prolonged training and a formal qualification. In order to become a nurse, one has to go through a specified prolonged training. It can range from 2 to 4 years. And then at the end of that training, there is going to be a formal qualification. Basically, you're going to be taking exams that will qualify you to ultimately then sit for the NCLEX. The NCLEX is the licensure examination, and upon successful completion, one is granted the full permission to practice as a nurse. So nursing is, of course, a career path, and I think of a career as building a house. So in order to build a house, you need a foundation, right? There has to be a foundation that you then build upon. So after one has gone through nursing school and have actually, been successful on the NCLEX examination, that is the foundation. That degree is the foundation of the career. But just as any house, if you don't work on the house, if you don't build the house, it's not going to be a house. You only just have a foundation. And so the way that you build on that foundation is to, as in the case of nursing, you get a nursing job. And as you get that nursing job, you get experience, you expand your knowledge base, you gain skills. And all of these are contributing to the building of your career. So in the previous slide, I just gave a general definition of nursing. And so in this slide, we're continuing with what is nursing. And here we're digging a little bit deeper into what the nurse does or what nurses do. Now, nursing is the holistic care of individuals, families, and communities. So what this means is that when you think of the word holistic, just think about comprehensive. Nurses care for patients comprehensively. So as we look at the holistic care of individuals, also comprehensive care of individuals, we also want to pay close attention to the unique components of this patient or of our patient. What are the things that makes our patient unique? Because at the end of the day, we want to care for the patient in a way that is very specific to them. And so here, when I have mind, body, spirit, culture, socioeconomic status, and environment, for example, if a patient comes into the clinical setting and that patient, maybe they got into a car accident and now they have an injury on their legs, right? Now, how does this injury affect the patient's mind? How does it affect their mental status? How does this injury affect the patient's self-perception? How do they perceive themselves at this point now? As well as regarding their body, are they now embarrassed because they have this injury? Are they ashamed of the injury? These are all important points to assess as a nurse. And then also their spirit. Is there any type of religious or spiritual practices that this individual is involved in that helps them to get through difficult times? And then also culture. Are there some cultural things that helps this patient heal? Are there specific foods that this patient would like to have while they are in the clinical setting? Are there specific times of the day that culturally they would just like to just have as private to themselves, right? So these are all things that the nurse is responsible for assessing so that we can care for our patients in a very, very holistic manner. So therefore, we also want to assess the patient's social economic status. So this word is actually two words in one. So the first part is social. So does this patient have a family? What's their social relationships like? What kind of relationship does he or she have with their family? Because that can impact their being in the hospital. And also just as a nurse, it's important to know because you want to know whether or not you should anticipate family members that may come, right? And so these are all things that we have to assess. And then also the economic aspect, how is this patient financial status, because sometimes patients come into the clinical setting, especially the hospital, and they're just really disturbed because they're not financially stable and they may not have insurance. And so they feel scared that the longer they stay in the hospital, they're going to have a big bill and they're not going to be able to pay for it. And the last thing is the environment. We want to know what type of an environment does the patient live in, because, they came into the hospital with an injury. And most likely, they're not going to heal 100% in the hospital. They're going to have to go home and fully recover. And so we want to know, what kind of environment is this patient going home to? Do they live in a 2-story building? And if they do, then the nurse has to ensure that the patient has assistive devices such as a walker or a cane that can assist the patient with safe ambulation as they discharge from the clinical setting. So now we're going to be looking at certain titles that belong to the nursing profession. So one of the titles that you will most likely come across is a CNA. A CNA is a certified nursing assistant. These are individuals who have gone through a type of training to be able to perform a certain level of care for patients. And so CNAs provide basic care to patients. So basic care includes like hygiene, bathing a patient, dressing a patient, assisting a patient to the bathroom, walking with a patient. Now, you also see their PCT. In certain hospitals, these individuals basically do the same tasks as a CNA, except that mostly a CNA is a title that is used in a nursing home, whereas a PCT will be used in a hospital. A PCT is a patient care technician, and these are individuals that, again, provide basic care for patients as well. So the other title in nursing is LVN or LPN. So if you live in the United States, depending on the state that you live in, you will be referred to as an LVN or an LPN. Of course, granted you've obtained this level of education. So an LVN is a licensed vocational nurse, and an LPN is a licensed practical nurse. These two titles and individuals who have these titles pretty much perform similar tasks, again, depending on the state that they are in the US. So these are nurses. However, there are certain things that are not within their scope of practice that they aren't able to do. So these nurses can administer medication. They can perform wound care, vital signs, etc. So the next title is RN. RN is a registered nurse. Now, in order to obtain an RN degree, one had to have completed an ADN program or a BSN program. An ADN program, well, actually, after having completed an ADN program or a BSN program, then one would sit for the NCLEX and then hopefully is successful, and then they would have that title as an RN. But basically, an ADN program is an associate's degree nursing program, which typically will take about 2 years to complete, versus the BSN program, which is a baccalaureate degree in nursing or a Bachelor of Science in Nursing, which typically will take about 4 years to complete. So if somebody were to go the ADN route, which takes about 2 years, then they would still have to go back for the bachelor's if they prefer, which actually it's becoming more mandatory now to obtain the bachelor's, and that would take an additional 2 years as well. And so usually the RN is, the nurse who has, let's say, the greatest amount of responsibility. So remember when I mentioned that the LPN or the LVN has certain limitations as to what they can do based on their scope of practice. So the scope of practice basically is just what you can do as a nurse safely based on your education. And so, for example, the LPN is not able to perform initial assessments. So if a patient comes into the hospital for the first time, the LPN really is not within their scope of practice to do that initial assessment to admit the patient to the facility. It has to be the RN. And so in a lot of different facilities where there are LPNs and RNs in operation, whenever there's a new admission of a patient, the LPN has to contact the RN so that the RN can come and perform all of the necessary documentation and everything that's involved with an admission. The LPN can follow up the patient's assessment after the RN has performed the assessment, and then the LPN then can continue to carry out the patient's plan of care. I also just want to add that an LPN program or an LVN program can take on average about 12 months to 18 months, depending on the program that you go for. And so sometimes certain people who are interested in nursing, they would choose to go the LPN route, and then they will come back, they would continue their education to RN and then further their education if they so prefer. The title that we have here is APRN, and APRN is an advanced practice registered nurse. So this is a registered nurse or an RN who has obtained a higher degree in nursing. So these are individuals that hold degrees such as certified nurse midwives, certified registered nurse anesthetist, clinical nurse specialist, and even a nurse practitioner. A lot of these individuals who are APRNs hold a master's degree. So the next type of a title in nursing is a DNP. A DNP is a Doctor of Nursing Practice. So yes, you can obtain your doctorate degree in nursing, and this is the highest degree that one can obtain within nursing. And this type of nursing is basically focused a lot on research. So they do a lot of research that will then support clinical care. Okay, you all, so that is it for today. I hope that you found this information valuable and helpful and informative. I hope to definitely bring you some more nursing knowledge. So until next time, talk to you later.